The Trauma Patient Assessment and Management Station is designed to test an EMTB candidate's ability to systematically examine a patient with trauma to multiple body systems and to appropriately manage the conditions found. Candidates can assume there are up to 2 assisting EMTs that will carry out verbal treatments requested. This station should take approximately 10 minutes to complete.
As you conduct your assessment, communicate with your partner. State exactly what you're assessing and what care you're providing as you perform the skills. This way, the examiner sees and hears you complete the skill. Most errors at this station occur because the candidate focuses on assessment but fails to appropriately manage serious conditions as they're discovered.
Candidates at this station will have equipment and supplies necessary to assess and manage a patient with simulated injuries. The patient may be wearing tear-away clothing to enable the candidate to expose, examine, and treat an area of the body. The patient will be moulaged, using items such as fake blood or prosthetic devices to depict the desired injuries. Equipment and supplies for assessing the patient can include a trauma kit with stethoscope, BP cuff and pen light, and medical exam gloves as part of the necessary personal protective equipment. Equipment and supplies for treating the patient's condition may include items such as trauma and occlusive dressings and bandages, supplemental oxygen, and a blanket. The main sections of the Trauma Assessment and Management Station involve BSI precautions and scene size-up, initial assessment, focused physical exam and history, or rapid trauma assessment, detailed physical exam when appropriate, and managing primary and secondary injuries appropriately.
Hello gentlemen, welcome to the Trauma Station. Your scenario is a 36-year-old male who's a victim of an assault. You've already examined your equipment, so go ahead and start when you're ready.
Begin the station by indicating that the proper personal protective equipment is being used.
Okay, at this time I'll go ahead and begin with BSI.
Before beginning the assessment, size up the scene to determine that it is safe, gather other information about the incident, and consider the need for spinal stabilization.
At which point in time I would evaluate the scene. Is the scene safe?
Yes, the suspect is in custody.
Okay, and how many victims do I have?
This is your only one.
Okay, at this time I would approach the patient, direct my partner to initially take C-spine stabilization.
Once at the patient's side, determine the patient's chief complaint and use the initial assessment to identify and manage any immediate life threats. These include the ABCs: airway, breathing, and circulation.
Make my assessment to the patient. Sir, can you hear me?
Yeah.
Sir, my name is Chuck. I'm one of the EMTs. Can you tell me what happened?
There's a guy. He had a gun. I turned and ran and fell. I hit my leg.
Okay, at this time, the patient is speaking to me. He's conscious and appears to be alert this time. He does have a good airway. We're going to check his circulation. He does have a good pulse. His respirations are a little labored.
Mm-hmm.
At this time, I go ahead and have a third partner come in and take manual stabilization of the spine. Go ahead and have my partner direct him to administer oxygen.
Okay.
Non-rebreather mask at 15 liters. I'll go ahead and continue my...
The initial assessment is complete with a quick check for any major bleeding and assessment of the skin. At this point, the rescuer should perform the focused physical exam and history or the rapid trauma assessment. The rapid trauma assessment is used if the patient has a significant mechanism of injury and possible critical injuries. Begin at the head and proceed to check the major areas of the body using the mnemonic DCAP BTLS. DCAP BTLS stands for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling.
What I see appears to be an obvious sucking chest wound with minimum hemorrhage at this time.
Okay.
Oh, my partner's go ahead and apply occlusive dressing to that. Okay, at this time I'll go ahead and direct my partner give me a base set of vitals.
Okay.
I would oscillate the chest, listening for lung sounds.
Okay.
Okay, at this point in time. Okay, at this time there's lungs counts were clear bilateral.
Okay, they are diminished on the right side.
Okay, diminished on the right side. What I would do is go ahead and take a quick look for an exit wound, see if I feel anything obvious at this time. I don't feel anything obvious, so I would recess at a later period of time. Go ahead and assess my patient's abdomen.
Okay.
Okay, it appears to be soft.
Yes, it is.
Okay, at this time I go ahead and examine the pelvis. Appears to be stable.
Yes.
We'll check the peritoneal. Go ahead and expose the lower extremities. Okay, what I appear to have a type of contusion to the lower extremity.
You have deformity and crepitus there.
Okay, do I have pulses?
Yes.
Okay, and neurologic response.
It's appropriate.
Okay, it's time to check the other leg. Okay, appears to be unremarkable. Do I have pulses?
Yes.
And neurological response?
Appropriate.
Blood pressure is 126/78.
It's 106 over 70.
70. At this point in time, this patient will be a load and go patient. I would go ahead and make sure I had advanced life support unit en route, also possibly a medevac. Continue with my assessment. And his pulses on his right arm.
Pulse
They're
is
present.
78.
Pulse is 98.
Pulse 98. Okay. And neurologic response.
Appropriate.
All right. Sir, how's your breathing now? Okay. At this time, I go ahead and move in position here. We'll do a log roll.
Respirations are 20.
Respirations are 26.
26. Okay. This time we'll have our third partner maintain stabilization while we do a log roll. On the count of the person at the head, I'll take place for that. It's 1, 2, 3. Exposing the back. I don't see anything obvious.
Correct.
Okay, at this time, I go ahead and sort of bring the backboard in. Roll them onto the backboard. Sir, do you have any medical problems I need to know about?
Use the mnemonic sample to gather pertinent information about the patient's history. With this information and the rapid trauma assessment complete, a decision has to be made regarding the transportation of the patient.
Okay, at this time, go ahead and get the patient loaded. Continue to recess vital signs en route. Also, just continue to do a reevaluation every 5 minutes.
In critically injured patients, the emphasis is on identifying and managing serious conditions and rapid transport of the patient to the appropriate medical facility. In this situation, a detailed physical examination is not likely to be performed until the patient is transported, and even then only if there is adequate time and the rescuer is not caring for serious conditions. When performing the detailed physical exam, repeat the DCAP BTLS steps beginning at the head and more closely examining each region of the body for additional injuries that may have been missed earlier.
Okay. Anything else?
No, that'd be it.
Okay.
With the scenario complete, the examiner checks the candidate's performance against the critical criteria for the station. The items at this station that would result in failure include failing to take or verbalize the use of body substance isolation precautions, failing to determine scene safety before approaching the patient, failing to assess the need for spinal precautions and to provide protection for the spine if needed, failing to provide a high concentration of oxygen, failing to identify or manage problems associated with the airway, breathing, hemorrhage, or shock, failing to assess the airway, breathing, and circulation before performing a detailed physical examination, failing to differentiate the need for transport from the need for continued assessment at the scene, and failing to transport the patient within 10 minutes.
Always remember the ABCs when it comes to assessing and identifying serious problems that require immediate attention. If you find a life-threatening problem, don't delay. Fix it right away.